Good morning and welcome to members of the board and to members of the public joining on MS Teams live or in person to this, the Royal Cornwall Hospital Trust's annual public meeting for the 2022-23 annual report and accounts. The purpose of an annual public meeting is for us as a board, as the current stewards of the Royal Cornwall Hospitals, to set out how the trust was run during 2022 and 23. And to explain our finances and our performance. We really hope that you find the presentations this morning interesting and informative as they set out what's gone well in this last period and what we're working to improve. As ever, we welcome questions from members of the public and are happy to receive those via the Q&A function on MS Teams or through our company secretary on issues relevant to the annual report and to our accounts. Questions can be put forward until just before the look back video is played towards the end of item 4. Questions will be put to the board at item 5. 2022-23 was another unprecedented year of challenge and unrelenting pressure, and I would like to offer my great thanks to colleagues, all colleagues, for your unfailing efforts during a year of constant adaptation as we moved through the latter stages of the pandemic, saw intense operational pressure, and all of that while working hard to keep current patients safe and provide the best care that we can. I thank you very sincerely for your dedication to the communities we serve. During these times, we relied on the support of partners in the NHS, local government and the voluntary sector. Working closely and supportively is vital to having a thriving healthcare system in Cornwall and the Isles of Scilly. So we thank all our partners for their close collaboration to ensure integrated services for Cornwall and the Isles of Scilly. We know that the relationship all teams are building will help us continue to move forward better together and in ensuring our services are best deployed to reach all members of our communities. Patient care is always our top priority, and staff experience is incredibly important to us. So during the second part of the year, we refreshed our plans for the future and launched our 10-year strategy. I really look forward to achieving more and working towards our aim to provide outstanding care for one and all, through our values of respect, compassion, honesty and teamwork, that acronym being RCHT, as many people will have noticed. Thank you again to all of those who work at the Trust, to their families and to our many volunteers for extraordinary efforts. We really couldn't do without each other. We are all members of a big team and we need each other. Importantly, though, I would like to thank our patients, their relatives and their carers. Without your cooperation, trust and help, we would not be able to serve you as we do. I also give my thanks to our Chief Executive and our board for their leadership, care, dedication and compassion. It's up to us to set the tone, the values and the behaviours we want to be available to all and absolutely demonstrate those values in everything that we do and say. And in line with that, also to be open to challenge and improvement ourselves. We're always pleased to hear of the great things that happen in our trust, especially during the board walkarounds that we do regularly. These are my favourite activities in my role as chairwoman. So thank you to our busy teams for welcoming me and other board members to your wards and teams. It makes a difference to the way we do our work. Thanks too to those patients who've shared their stories with us, both good ones and those that we can learn from. This role that I have is a privilege and a great pleasure. And so following on from that, finally, it's my absolute mission to increase the diversity that we have on our board. We do have diversity on our board, but it tends to be hidden. And so we are going to continue with our quest to do better. We are going to be holding another recruitment campaign for non-exec directors this autumn, and it will include pre-application sessions to assist members of all communities to understand better the requirements of the role. I absolutely welcome anyone, particularly from ethnic minority communities, to show an interest. If you don't see an advert, please contact me personally and I'll be sure that you receive the information you need. So having said those thanks, which I mean absolutely, I think without further ado, we'll move on to the main agenda. First of all, do we have apologies for absence this morning? Lindsay.
Thank you, Chair. We have apologies from Richard Stevenson, Alid Jones and Sarah Newton.
Thank you very much. So moving on to item 2 on the agenda, declarations of interest. Are there any interests that the board members wish to declare in relation to items presented today, other than those already disclosed in the Register of Interest? No, thank you. So then moving us on to item 3, can I invite the board to approve the minutes of the last annual public meeting held on the 22nd of September 2022? Nods? Yep, lovely. Thank you very much indeed. That brings us then to item 4, and I would now like to invite Steve Williamson, our Chief Executive, to lead off with his reflections on the challenges and the triumphs the Trust faced during 22-23, and I think giving an overview of our performance. Thank you, Steve.
Thank you, Mary. As you know, every day Royal Cornwall Hospitals provide specialist hospital care to well over 2,000 people every day. We deliver over 500,000 outpatient appointments every year, almost 90,000 presentations to our emergency department and urgent treatment centre, around about 4,000 births a year, nearly 1.5 million laboratory specimen and over 340,000 diagnostic examinations every year. And every single day, the care that our amazing staff deliver saves lives, improves lives and supports communities. And I think it's right to say that our services touch the lives of everyone across the Duchy and everyone across the Isles of Scilly. So I'd like to start our annual report by saying thank you to every one of our staff for the amazing care that they provide. Dalap Ariel Kerno Clavji Trust Service Canedlic an Yegas Mia Res their Agas offering, which is Cornish for to the staff of Royal Cornwall Hospitals NHS Trust. Thank you for your service. Our teams across Royal Cornwall Hospitals deliver that care in what is a really exceptionally challenging operating environment. Whilst during this year we have started to emerge from the COVID pandemic, we have had to continue to manage the infection and transmission risks that poses for some of our most vulnerable patients and our staff. Our trust managed an exceptionally challenging winter period with significantly increased demand and ongoing challenges with a number of patients who finished their acute hospital stay but were waiting to go home with community care or waiting for some other form of onward care. And that did result in significant delays in our emergency department and ambulances waiting to hand over, and also in the response time for ambulances across Cornwall. It required our teams, with similar actions actually from other parts of the health and care system, to take really significant escalation actions to mitigate those risks and manage that demand. And as we know, that included opening additional wards such as our frailty and elder care ward in our fantastic Tremenal unit, but also required us to open additional temporary spaces in some of our existing wards and elsewhere. And that certainly placed pressure on our staff and impacted on the experience of those patients using those facilities. And in fact, those challenges have in many respects provided an even tougher environment for our staff than perhaps the first 2 years of the COVID pandemic. They've impacted on the care and the experience that we're able to deliver. And again, I wanted to say thank you to our staff for the way in which everyone across our organisation has approached those challenges and those demands and sought to take every possible mitigation action so that we can continue to provide the best possible care to our patients. And in these exceptionally challenging circumstances, our nurses, doctors, allied health professionals, support workers, and actually colleagues right across Royal Cornwall Hospitals have delivered some amazing successes. CQC rated our maternity care as good, We commenced the enabling works on our new Women and Children's Hospital. Our digital team paved the way for a new electronic digital patient record. Our outpatient transformation team were national award winners, and our teams delivered a small financial surplus. We opened our fantastic new Tremenal unit, which enabled us to deliver a frailty same-day emergency service and a frailty elder care ward, and many, many other incredible achievements. Our teams across Royal Cornwall Hospitals have achieved so much in any environment, but particularly that challenging environment. So Muras, thank you to everybody at Royal Cornwall Hospitals NHS Trust. And if I turn to safe, high quality care, the first of our strategic objectives, our overall trust CQC rating remains as it was from December 2018 CQC inspection, which is an overall rating of requires improvement. We did have 3 CQC inspections reported in 22-23. 2 of those didn't provide a rating. They covered urgent and emergency care and our medical wards. But in December 2022, the CQC carried out the inspection of our maternity services, and they particularly looked at the safe and the well-led domains. And as I said just now, I'm really delighted that their assessment of our maternity services was good. Our amazing cancer teams were named amongst the top 10 hospitals in the country for their National Cancer Patient Experience Survey, which was fantastic to see. In fact, overall, across all of our services, 94% of people who completed the Friends and Family Test Survey said they would recommend our hospitals. We did see the demands in 22-23 from the operational pressures reflect in a range of our performance measures. Our emergency department 4R standard at Royal Cornwall Hospitals averaged 43% for the year, and whilst across the entire urgent care emergency department, urgent treatment centres and MIUs performance was significantly higher, we did see that demand in our emergency department, and we saw extended waiting times for ambulances to hand over to emergency department and in their response times. We took as an organisation a whole range of escalation actions to minimise that impact and mitigate that, including the Tremenal ward I've already mentioned, but a range of other ward facilities were expanded. Additional capacity was put in place within our organisation and across the system to mitigate that impact as much as we were able to do. We have seen significant improvements in our ambulance handover time and our ambulance response time over the past 4 months, which is very positive to see, but we still do have a long way to go, and that remains an absolute priority for all Cornwall Hospitals NHS Trust, and I know it remains a priority for partners in the wider health and care system. We did continue to see sustained high numbers of patients who'd finished their acute hospital stay and were waiting for some form of onward care. And that impacted not only on our urgent and emergency care performance, but it also impacted to an extent on our elective care waiting times. So the second significant priority for us is to reduce the waiting times for elective care. And that's continued well this year, but has been further impacted by the effects of industrial action, which has been underway in one form or another since the spring of this year. We, of course, can't deliver those kind of improvements without support from partners across the health and care system, and they face similar extraordinary pressures in all parts of the health and care system, and we're certainly grateful for their support. If I move on to our second strategic priority, supported and valued people. People are absolutely our strongest asset, and as Chief Executive, I've been in the role now for just over a year and a half, and I'm still amazed and humbled by the way in which colleagues across our organisation go above and beyond every single day to do the very best they can for our patients and for each other. The continued support that they show for our patients and our families has been really remarkable, and they strive every single day to provide the very best possible service and care that we can. The pandemic and those operational pressures I've already mentioned have challenged us over the last year, and it's perhaps not surprising that our results in the latest NHS staff survey were slightly reduced to previous years in that context. We're absolutely clear that positive staff and patient experience go hand in hand, and what we want to see is a culture and an environment that enables our staff to have the kind of experience that our patients report through the Friends and Family tests. So we're working very, very hard to support staff well-being, and to consider what else we can do to provide an environment that enables staff to do the very best and deliver the care that they aspire to. We also undertook our staff awards celebrations, where we saw more than 400 teams and individuals being nominated for awards by their colleagues, by patients and by carers and families from across Cornwall and the Isles of Scilly. We presented the COVID-19 Star to staff across our organisation as a small recognition of the extraordinary and selfless efforts made by so many through the COVID pandemic. And we also provided an extra day's additional leave as a recognition for the impact of COVID. Each of those small steps, but mechanisms to try to find a way to say thank you and to recognise the extraordinary efforts that staff made throughout the COVID pandemic. We saw a whole range of awards and celebrations of individuals and teams across Royal Cornwall hospitals. I've already mentioned the Outpatient Transformation Team, who won the National Digitising Patient Services Award. And that was all about reflecting the outstanding work to improve access, to increase access, and to increase the utilisation of our outpatient services. And those things directly translate into that second priority of reducing waiting times and improving access into our elective services. We've worked hard on organisational culture, and that culture really being founded in an environment where staff feel safe and supported to speak up and raise concerns. We have a network of nearly 50 Freedom to Speak Up champions and a whole range of mechanisms, including anonymous mechanisms for staff to speak up and raise concerns. And I would say to all of our staff across Royal Cornwall hospitals, those concerns can be raised in a whole range of ways, and that includes directly to any board member who can receive that either openly or in confidence as well. We've worked really hard to build relationships with our university partners, and we've got memorandums of understanding in place with Falmouth University, Universities of Plymouth and University of Exeter, and we anticipate they'll bring us significant benefits to supporting education, research and innovation at Royal Cornwall hospitals for the staff that we have now and to support us with our pipeline of staff for the future. And whilst not part of our staff, I'd also like to acknowledge the amazing work of our friends and volunteers who not only fundraise, but they provide invaluable services to support our patients and their families. And if I finally move to our journey of improvement, our third strategic objective, we've seen this year the establishment of the integrated care systems across the country, and in our case, the Integrated Care Board in Cornwall and the Isles of Scilly. And we've also seen the establishment and the formalisation of provider collaborative arrangements between Royal Cornwall Hospitals and Cornwall Partnerships NHS Foundation Trust, and between Royal Cornwall Hospitals and the other acute hospitals across the peninsula of Devon and Cornwall. All of that heralds new opportunities for us to work differently in partnership so that we can do our very best to ensure the population of Cornwall and the Isles of Scilly has access to outstanding care as close to home as is possible and sustainable. We did extensive engagement with staff across our organisation over the year of 2022-23, and that helped us shape and launch our 10-year strategy in November 2022, setting out our vision of outstanding care for one and all, and also setting out the steps we'll take to deliver our local priorities and respond to NHS England's national priorities. So some of the things that are set out and are now progressing within that strategy are our Women and Children's Hospital, and we saw during 22-23 the commencement of the first stages of the enabling works for what will ultimately be a £290 million Women and Children's Hospital, which will be the biggest single ever investment in healthcare in Cornwall and Isles of Scilly history. We opened the Tremenal unit that I mentioned earlier on, which enabled us to increase our elder care ward capacity and open a frailty same-day rapid assessment unit. We progressed the building works for a new Lowen MRI Cancer Centre, and that subsequently opened as a fantastic state-of-the-art oncology ward, fantastic MRI and diagnostic facilities, really transforming the environment in which we provide care to cancer patients. We progressed work on our children's play garden and our critical care healing garden, and in fact we're formally opening the critical care healing garden later today. We replaced CT scanners in the Sunrise Centre, installed breast screening equipment in the Mermaid Centre, and progressed a very significant patient flow improvement programme so that we can ensure we're doing the very best we can within Royal Cornwall Hospitals to address some of the operational pressures I talked to earlier on. Going forward, engaging with our population, our patients, and those who rely on our services will be at the heart of our vision of outstanding care for one and all. So if I can conclude before I hand over to Kim, this last year has been incredibly challenging for colleagues right across Royal Cornwall Hospitals, NHS Trust, and I'd like to thank everyone who's played a part in that journey. Every one of our staff has had an important role to play. But I'd also like to acknowledge the leadership of our board members in supporting that journey and in supporting our colleagues and staff across Royal Cornwall Hospitals NHS Trust. So if I can now hand over to our Chief Nursing Officer, Kim O'Keefe, to present our quality improvement highlights. Thank you.
Thank you, Steve. So I will try and do justice to the many events and qualities that our staff and our partners have provided over this time. So our quality improvement highlights. Firstly, can I just echo what Steve has said? The actions of our staff and partners in our unrelenting ambition to keep our patients and our staff safe continue to make great strides as we look at quality and safety improvements for our population of Cornwall and the Isles of Scilly. And it's truly, at times, very humbling to see. So working with our partners to improve patient flow, think 111 to redirect walk-in patients, and this is really important to make sure that they are seen elsewhere appropriately and timely. We also implemented a new frailty model in our emergency department, and that includes working with CFT, looking at a new CATU model across the county. We took time to introduce a team of discharge coordinators, and that's really important, reflecting the complexities now of our population and to be able to discharge them both timely and safely. And we have more patients going home now via our discharge lounge, and we have our our flow program, which will continue that work in the coming months. Our next slide, better assessment and faster discharge. We've been working with Healthwatch Cornwall in response to their discharge report, and that was about how our patients felt about their discharge from both provider organisations. And it just goes to show the importance of listening to our patients and their carers about what they want in their discharge. So looking at the comments, we made substantial changes to our discharge checklist to make sure both our patients and their carers had a dedicated contact number, a place where they could phone following their discharge if they had any queries, and that helped assist. Often when being discharged, no one takes everything in, so having that dedicated line has really helped our patients and their families. We've established a volunteer hub to assist patients and families post-discharge with things like running errands, or if they'd forgotten things, or if their medication had been delayed, to be able to take it to them at home. We listened to our nursing staff, and we looked at our nursing assessments and revised them and uploaded them on the new electronic platform called Nerve Centre. So both listening to both patients and our staff remains our top priority to be able to make the improvements required. Next slide, please. Safer care. Over this period and under unrelenting operational pressure, only one never event was reported for the year, and one is too many, but absolutely learning from that event and taking that shared learning forward demonstrates our capability as a learning organisation. We reduced our number of falls by 7.25%, but most importantly, we saw no increase in the severity of the falls, but we continue with our integrated falls improvement plan to have this as a focus of our attention. And we trained over 100 staff members in human factors techniques, and this will continue, and this further provides a safe place to learn and a safe place to share and understand both the culture of teams as regards to safety culture. Next slide, please. Looking after our staff, as Steve and Mari have both said, our staff remain our strongest asset, and we continue every day to be humbled by the way they go over and above for our patients and each other. They continue to support with patients, our patients and their families, and we continue to strive every day to provide the level of service they deserve. So staff health and wellbeing has been one of our top priorities. To this, we've opened an outdoor green gym at RCHT. We've looked at social staff prescribing, and to that end we've had great success in both providing open water swimming for the very, very brave and surfing for the adventurous. We've celebrated the first cohort of graduating Chief Nurse Officer Research Fellow graduates, and that gives our Band 5s and Band 6s staff nurse dedicated time to look at a research project within their own areas and have that link between evidence-based care and providing better care for the future. We've also established a network of colleagues who are professionally trained in being able to debrief our staff following a traumatic work event, which has proved very, very successful across the organisation. Next slide, please. Working towards outstanding care, not just for celebrating, as I've said, for last year, but what are we taking forward as the year goes by. So we're looking at improving our care for patients with delirium, and that has been a strong focus, looking at both patient, carer and staff feedback, and that has started to roll out, and we had one of the first away events the other month. We continue to look at reducing delays, and our patient flow program is absolutely instrumental to that. And this is to provide a safe passage of care through our organisation to get the right acute care, but most importantly, to make sure people are discharged in a timely and safe fashion. We have committed to reduce pressure ulcers by 10%, and we are working hard across both organisations to make sure that we've got an integrated improvement plan to be able to ensure that this takes place. And really, really proud to say both RCHT and CFT have now launched their patient leader program, and that will continue to grow over this year. And that truly puts the voice of a patient into some of our instrumental transformation, which will be collaborative, and we look forward to seeing the fruits of the labour there. And I shall hand over to Carl. Thank you.
Thank you, Kim. As Chief Finance Officer for RCHT, I'm very pleased to present a summary of the Trust's annual audited financial statements for 22-23 to this annual public meeting. Can you go on to the first slide, please? With the challenges the NHS faced with COVID in the 2021 and 21-22 financial years, this last year was the final year of interim funding mechanisms linked to residual COVID costs and retained services. The financial framework included a move to system-based resource allocations, significantly reduced COVID top-up funding, an income based on fixed payments with assumed achievement of elective activity targets, noting a broad continuation of block contract arrangements with commissioners. There was also an adoption of a new accounting standard for the NHS, International Financial Reporting Standard 16 relating to leases, which brought leases onto the Statement of Financial Position. The 2022-23 year was very successful financially for the Trust. We achieved our key financial targets, and our auditors reported that the accounts were submitted on time, properly prepared, and gave a true and fair view. We met our core statutory duties in respect of cash and capital, and there were no misstatements in the accounts, noting a number of recommendations on presentational issues from the auditors were adjusted. It should be noted, however, that a Section 30 referral to the Secretary of State regarding our ongoing historic cumulative deficit incurred in previous years, as the expectation was that this historic deficit would not be recovered in 23-24. We also received, for the third year since the launch of the auditor's Value for Money report, one significant challenge relating to the securing of economy, efficiency and effectiveness in the Trust's use of resources, which related at that time to the forecast challenging position that we'd forecast for 24-25 financial plans. Next slide, please. Thank you. With regard to the key financial performance measures in 22-23, I'm pleased to report that the Trust delivered a small surplus, £600,000, relating to compared to the planned break-even position. We also achieved our cash targets with a year-end balance of just under 25 million, and also there was significant levels for the third year on the trot of capital investment for the Trust. £47 million of resource and expenditure was received and incurred, which across the previous year in 21-22 and 22-23 added up to around £91 million of expenditure on capital. We're also able to maintain our better payment performance targets with around 90% of all NHS and non-NHS invoices by volume and value paid on time by the Trust. Next slide, please. The Trust income has increased significantly over the last 3 years. In 2021, the turnover was 537 million. In 21-22, it's 580 million, a growth of 8%. And for 22-23, now reached 624 million pounds, a further increase of 7.5%. The most significant elements of income are set out in the chart. The main source of income via block contract was 433 million from CCGs as a precursor to the ICBs. And in the previous year, that was 409 million. In the main, this is from Kernow CCG, now Cornwall and Isles of Scilly ICB, at 430 million. 130 million pounds of resource was received directly from NHS England, which includes, for example, specialised commissioning income and specialist cancer drugs. And other income was around 61 million pounds, including education, training and research, of which the element was 21 million, and that increased by 2 million pounds on the previous financial year. Next slide, please. The expenditure chart demonstrates the breakdown of expenditure by type, which proportionately is broadly consistent with previous years, although the value-wise has significantly increased. This includes £380 million in 22-23 on staffing, compared to £341 million spent in the previous year. And the year before that was 309 million, a significant increase in staffing cost over those 2 financial years. There's a small increase in supplies and consumables, 135 million compared to 134 million, noting that there was a change, of course, in COVID-related consumable costs. Next slide, please, Lindsay. This slide demonstrates where we spend our resource across the organisation, and in the main, across direct patient care. 73% of our expenditure is focused across our various care groups, as shown in the slide, and broadly split across those care groups, demonstrating how we manage our services across the organisation. Thank you, Lindsay. Next slide. Steve has already touched on some of the significant achievements across our organisation relating to capital expenditure and bringing into use new operational assets. In terms of capital projects and investment, expenditure has been at unprecedented levels over the last 3 years, as I mentioned. In 2021, this was at 55 million, 21-22, 44 million, and this last year, 47 million, as you can see on the chart. Capital expenditure was made up of a number of resource elements. Our core capital expenditure of around 17 million, and then a balance of funding around specific investments, one of which was the MRI and oncology building of 13 million pounds in 22-23, and as Steve has mentioned, this was brought into operational use this spring. The total project cost for that facility was 35 million. It was on budget and on time, and that was a significant achievement for the organisation, Residual costs relating to the opening of the Tremenel unit also was a part of the costs in the last financial year, and the first year of our electronic patient record, 12.1 million. The Women's and Children's business case development costs were around £2 million, and of course that's part of the wider £291 million investment that we project over the next 5 years. Other schemes included over £9.4 million on medical and other high-value equipment, including £5 million on replacement medical equipment and £2 million on mammography equipment and service space around that facility. We spent over £6.5 million on estate's backlog maintenance projects, including fire remediation works at £2.8 million, and that also is a part of a multi-year programme for around £10 million investment in total. In summary, whilst an incredibly challenging year operationally and financially for the Trust, delivery of the key financial targets was a major achievement for the organisation. And I would finally like to put on record my thanks to the finance team and, of course, the wider organisation for this significant achievement. Thank you very much. And I think the final slide just reflects on where colleagues can access the annual accounts. Thank you very much.
Thank you, Carl, and thank you, Kim. Hopefully that gives board members and any colleagues that are watching from the public an overview of the challenges and the delivery that Royal Cornwall Hospitals Trust has achieved over the last 12 months. We're going to move into a 10-minute video which brings to life some of those particular developments and achievements, and then we'll be moving into any questions from members of the public.
2022 to 23 was a year of pressure and recovery, of hope and care, of partnerships and learning. Our outstanding staff were tired, yet continued to work together, supported by our dedicated volunteers and wider health and care system partners to do their best for our patients. The new integrated health system structures, introduced from the 1st of July 2022, have enabled us to further explore and define our role as a valued health partner in the county. The need for a more holistic approach to support our staff has never been greater. There is no doubt COVID-19, coupled with the unprecedented operational pressures, recruitment challenges, housing affordability, and the cost of living crisis have been tough. We introduced initiatives such as stress-relieving cold water swimming courses and personal health checks. We recognised the enormous efforts of our people with the summer party and award ceremony, and placed a huge priority on supporting the mental well-being of our people. Feeling a sense of team and teamwork is so important for well-being. It's that sense of team which has enabled us to do some things differently, to innovate, even during the most difficult of times. And that sense of team extends to our loyal and valued team of 400 volunteers who work with us to provide additional support to patients across our hospitals. From the reception desks, coffee shops, library trolleys, and companionship, our volunteers are there providing a kind word, a listening ear, a hot cup of tea, or directions to an appointment. The past year has seen us welcome around 200 international nurses and other healthcare professionals to our team, where we now have colleagues from more than 80 different countries making up our workforce. This brings a huge wealth of cultural diversity, which is reflected in the priority we're giving to equality and inclusion, educating our people, and the reinvigoration of our staff networks. The demand for care in our hospitals and right through the health and care system across almost the whole year were indeed tough, and were most visible from the ambulance queues at the emergency department at the Royal Cornwall Hospital. Challenges with delayed discharges and increased elective care waiting lists highlighted the difficulty we had in making space in our hospitals to care for those who needed it the most. To minimise delays, we made better use of a wide range of community-based care and support, including virtual wards, acute care at home, and the extensive range of services provided by the voluntary sector. Through the actions we took in readiness for winter, we also opened over 80 escalation beds and spaces, including a frailty same-day emergency care unit and an expansion of our discharge lounge. Our teams at St Michael's Hospital were extraordinarily flexible in supporting the care of medically fit patients awaiting discharge, utilising beds that would otherwise be used for those waiting for planned orthopaedic care. And our medical wards at West Cornwall Hospital and other surgical wards at Royal Cornwall Hospital frequently made space to care for patients from medical specialties. This was hard for teams in the knowledge that they had patients in need of treatment, but who they were unable to admit. Throughout, our priority focused on people with cancer and other life-limiting illness, but we were always mindful of the impact on the physical and mental well-being of those who are waiting for routine procedures. There were green shoots of recovery at the end of 22 to 23, and essential to our ambition to further reduce waiting times this year will be the ability to protect our key elective care facilities at St Michael's and West Cornwall hospitals. The opening of a new community diagnostic hub at Bodmin Hospital has increased the imaging capacity and is speeding up diagnosis for patients with cancer and other conditions. Since the opening in October 2022, it has been enthusiastically welcomed by people in Mid and North Cornwall who now have more convenient access to these diagnostic services. And we have continued to see a shift in the move towards virtual outpatient appointments, with telephone and video consultations now making up around 1/3 of our outpatient activity. Age has not proven to be a barrier to technology, with patients of all ages engaging in our patient hub, which provides access to online appointment booking, text reminders, and access to letters and test results. We made strides in the last year to further improve the way we hear from our patients, from valued partnerships with patient groups such as Kerno Maternity Voices, who are helping us to understand experiences of our maternity services, to our new Patient Leader program. Listening to and learning from the people who use our services is one of the best ways we can keep improving. We've been working to better understand our role as an anchor institution in Cornwall and the Isles of Scilly, and how we can help reduce health inequalities. As a partner in Cornwall and Isles of Scilly Integrated Care System, we have welcomed the new developments in system governance frameworks. We contributed to the development of the system's first ever joint forward plan and joint capital plan, ensuring alignment across our partners on the key things we will work on together to help the people of Cornwall and the Isles of Scilly start, live, and age well. Our partnerships are broader than just our health and care partners. During 2022 to 23, we signed a Memoranda of Understanding with the University of Falmouth and University of Plymouth. Alongside our existing MOU with the University of Exeter, these helped put us at the forefront of advances in areas such as medical device design, digital health transformation, and environmental sustainability, and strengthen our research and development expertise. Clinical research has a key role to play in enabling our patients to take advantage of the latest treatments and technologies, as well as building our reputation as a research hub and thus an attractive employer. RCHT is a pioneer of sustainability within the NHS, contributing to the overall NHS Net Zero target. We have continued our involvement with innovative projects, with the trial of a modular laundry system to support reusable theatre textiles, and collaboration with Falmouth University to explore how single-use plastic products within the hospital could be replaced with products from a recycled theatre tray wrap. Our new buildings and refurbishments included sustainable features and digital innovation from the outset. We opened the Tremenno unit in November 2022, and our new purpose-built MRI and oncology unit opened in spring 2023. We've also been busy improving our outside space, with 2 specialist garden projects developed during this period. We created a new children's play garden and started construction on a critical care healing garden. While operational challenges remain, we're starting to see improvements in our ambulance holds and the number of delayed discharges. We look forward to more innovation and transformation of our estate and digital infrastructure, providing us with state-of-the-art buildings and tools to better connect the care we provide and enable cutting-edge treatments. And no one project embodies this sense of hope as much as the Women and Children's Hospital programme. It's not just new physical builds we're excited about. We're planning for a new electronic patient record system to be delivered over the next 2 years, helping clinicians and support teams have a much greater range of patient information at their fingertips, and empowering patients with more advanced patient portal capability. As we acknowledge and reflect on 2022 to 23, we move forward into 23 to 24 with respect, compassion, honesty, and teamwork. Together, we aim to improve Category 2 ambulance response times to an average of 30 minutes, with further improvements towards pre-pandemic levels in 24 to 25. Eliminate waits of over 65 weeks for elective care by March 2024, except where patients choose to wait longer or in specific specialties. Continue to reduce the number of patients waiting over 62 days for cancer treatment. Make significant improvement in the percentage of staff who would recommend RCHT as a place to work. Deliver a balanced net system financial position for 23 to 24. But the way in which we seek to deliver those 5 priorities, using our new trust values as our guide, is more important than any outcome. We are RCHT.
Thank you. Thank you, Steve and Kim and Carl, for your presentations, and thank you to all of our executives for work, as we've just seen in that video, which I think we can genuinely be proud of. We do spend a lot of time learning from things that we don't get as good as we'd like to, but I think that video absolutely gives evidence of what you guys and all of us should be proud of. I really thank you for that. And then my special thanks go to you, Pete Young, Laura Mason and Richard Pearson, for designing those engaging infographics in the slide deck and for scripting and putting together that wonderful video. I think the levels of professionalism that have just grown and grown over the time that we've been doing this. So it's absolutely magic. Thank you very much to them. So now if I just completely come to the formal bit, I would invite our board members, please, formally to receive and adopt the Trust's annual report and accounts for 2022-23. If you'd be good enough to indicate in the chat your acceptance of those. And that then brings us in quite good time, I think, to questions. We do have 15 minutes to take questions in line with the protocol. And if I could ask our Acting Company Secretary, Lindsay Neve, please to put any questions to the board and to help me manage any responses. Lindsay.
Thank you, Chair. Unfortunately, there have been no questions raised today. So thank you to members of the public for watching the video, watching the live stream. Unfortunately, there were no questions posed to the board today.
Thank you very much, Lindsay. And I hope the fact there were no questions means we've been very explicit, but please be assured if you do have questions, all members of the board, and in particular Steve and our executives, are always ready and welcome questions because this is your acute hospital trust. It's not ours, and we really do want you to be part of our going forward thinking. That then, I think, brings us to the end of our annual public meeting for this year. If I could probably end by saying thank you to members of the public, our staff, patients and stakeholders and partners for your engagement and interest. And can I thank members of the board for your continuing stewardship. I said at the beginning, it is a real privilege to be doing these roles. It's also a huge responsibility, and I really value the time and care that you put in to that. So at that point, if I could then declare the annual public meeting closed for this year. Thank you all very much.